Hi, again, this is Dr. Gharagozlou from Healthy Sleep Care. Today we are going to discuss the shift work disorder, when shift work causing a disorder and is more pathological than the usual shift work. To have that, we need the individual to have insomnia during the sleep time and a sleepiness during wake time. And it definitely will cause a sleep maintenance problem and also falling to a sleep problem. And usually we need a few months to be able to diagnose that. This is not an issue that we want to diagnose with a few days or a few weeks. Normally in sleep medicine, we'll look at the pattern, long-term pattern or lifetime pattern, or patterns that persisted over a stretch of time like a year or several months. So sleepiness during wake period includes a sleepiness during work period that causes performance issues and safety issues. For example, if let's say a pilot is very sleepy, he cannot fly the airplane well. And also during the commute, so when you're going back to home after the work, or sometimes even going to work after your rest period that you couldn't really sleep well in the daytime. Both of these times there is increased risk of car accident. Let's say a nurse is going home and they are sleepy and they can get into the car accident. That's a problem. Also, the quality of life of the patient decreases because they cannot get to the socializations they want. They cannot get to the chores that they want to do. So they always have something missing in relation to people who have a 9-to-5 job. And also when I assess a patient, a lot of time we see an overlap between insomnia, shift work disorder, a sleep insufficiency, and also a sleep disordered breathing. Don't forget that a significant amount of population, especially in US, have a sleep disordered breathing, like a sleep apnea. And if you're a shift worker, you tend to eat more in abnormal times. So those people, they have to be very careful about development of a sleep disordered breathing that increases with the increase in the body mass index and obesity. And all these issues can contribute into the patient's symptoms, and it's not because of one thing, it's because of contribution of many different sleep disorders into one person who is trying to get a living, to have a life. Shift work disorder, based on who you ask, will affect 10% to 30% of all shift workers. So it's not that uncommon. I see it all the time. And also it can cause significant impairment in the function of the worker. People with shift work disorder are known to have more episodes of anxiety and depression, and this is worth paying attention that new diagnosis of anxiety and depression also increases in them. So we didn't statistically prove that shift work disorder can cause anxiety, but there is a lot of indirect data that shows that. Also, these people have decreased amount of memory function, decreased attention, increased family problems, and one study show in men the testosterone level drops in these shift workers. To diagnose, interview is enough. We don't need too much of medical examination, only to rule out other things. And it is important that we know that a sleep study is not required. But you have to remember, if you are suspicious about a sleep disordered breathing, a sleep apneas, then of course we need some kind of a sleep study. But a sleep study is not required to diagnose a shift work disorder. We normally want to document the way the person is sleeping, so a sleep diary or a test called actigraphy or actigram is very helpful to do. There is another video that I talk about all these tests and how they are done and what they are. So as we discussed, sleepiness and insomnia are two major symptoms of this disorder. However, we can look at, for example, a sleep disordered breathing, a sleep apnea, or narcolepsy. They have the same symptom, especially the sleep disordered breathing. So there is an overlap between the symptoms, so the doctor has to be astute and to be able to pull out the diagnosis and co-diagnosis of the patient. So this is another reason that you have to see a sleep physician for your sleeping problems. Shift workers are prone to have insufficient sleep, which is another problem. So when we interview, we want to make sure we are not missing insufficient sleep and addressing that as much as possible. And also shift workers, especially people who have shift work disorder, are more likely to show abnormal sleepiness. One study showed that 22% of non-shift workers show symptoms of too much sleepiness versus 44% of shift workers show the same symptoms. So there is definitely more risk of sleepiness in people who have different types of shift work. Additionally, we know that a backward rotating shift shows most of the symptoms and is particularly troublesome. And the least troublesome shift work is the evening shift, even though that has problem with socialization. When you see a shift worker, it is very important to pay attention to their general health because they are at higher risk of other medical issues. Especially look for amount of alcohol use, amount of drug use, their diet. They are prone to eat more and eat unhealthy. The amount of nicotine or cigarette use. Discuss their sleep hygiene and make sure that their preventive care is up to date. As I said before, for example, breast cancer or colorectal cancer has been seen to be increased in people who do a lot of shift work. Different modalities of treatment are available. The data shows the number one best treatment for shift work is not doing the shift work. Go back to the day job. If that is not possible, try to talk to the management and go to a forward rotating shift if you have a rotating shift. If that is not possible, evening shift is another option that you can try. Some data shows self-scheduling of the shifts is very helpful and people benefit from that. Your doctor can write something that based on your jurisdiction and your state, maybe the employer have to follow. Also, we can look and see if this person is a early bird or is a night owl and recommend shift based on their own chronotype. So they are working at the time that they are most likely to want to be awake. That's how their brain works. For example, if somebody is an early bird who wants to sleep early at 2-3 o'clock in the night, it's very hard for that person to work. So we want to change the schedule based on what the patient does, for example, when they have a long vacation. So that is the best data about somebody's natural day and night cycles. It is shown that if you use bright light, around 5 to 10,000 lux, at the first part of the wake period, which is the first part of the first half of the work shift, it helps people to adjust to that schedule better. Also, sometimes use of melatonin at the time of when they want to go to sleep could be helpful, but that needs to be used by somebody who is expert in using melatonin to shift the circadian cycle. Use of cognitive behavioral therapy to decrease the amount of insomnia has shown to be helpful. And also, we need the appropriate time in the bed. You cannot go home and start watching TV and doing this and that, and then you also get a sleep insufficiency. When you go home after shift work, make sure you use sunglasses, and then immediately go to bed. Make sure the bedroom is calm, a little cooler, and also quiet and dark. You can use the blocks on the windows so there is no light coming in. That is also shown. Some of the data suggests that if you break your sleep period into 2 periods and sleep 4 hours first and a few hours right before your next shift, that gives you some opportunity for socializing in the middle or taking care of your chores, and also gives a general better outcome as far as the sleep is concerned for a shift worker. Also, the second part of this two-part sleep strategy can be moved based on if you are a shift worker who are working that day or who is not working that day. So basically on the off days, you can move your second sleep period accordingly when it helps you better. There are medications. Obviously, hypnotics have been used in people who have a lot of insomnia and cannot fall asleep. I think I read something about 20% of police officers use hypnotics to be able to fall asleep after their shift because of the a lot of vigilance that they have to take during their work time. Make sure you don't use alcohol, it never helps. If you want to use hypnotics, very short-acting hypnotics help you to fall asleep, something like Sonata, but also you can use medium range hypnotics to keep you asleep for a few hours without waking up, that then cause too much sleepiness in the night. So another strategy with medication is to use medication that enhance wakefulness during the time that you want to be awake. And for specifically for shift work disorder, amphetamines and methylphenidate are not very helpful and are not the top choice unless the patient needs them for another reason. There are 2 medications that are approved and widely used called modafinil and armodafinil. They are a scheduled medication based on very low likelihood of addiction that they do have. In my practice, over many years, I never had problem with addiction to modafinil, and the likelihood is pretty low. If you want to use them before the shift starts, at least around 1 hour before the shift starts. Obviously, use of caffeine and naps on strategically placed napping has been discussed in the literature, and there are programs in the country that use a strategic napping for the workforce. Here we are talking about one person who probably doesn't have a lot of opportunity to nap in the middle of the work shift, especially in the night that people have a skeleton staff. Again, remember, number one, treatment for shift work disorder is not to be in the shift work and to have a normal day job. If you have to shift work, try to be in a fixed shift work shortest time you can. As you advance in your life, get out of that job and get a regular day job. Don't think I like this for a very long time, because there is clear data that shows there is significant amount of health hazard associated to shift work. If you are in a rotating schedule, try to be in a forward rotating schedule. Don't forget about use of bright light, use of eyeglasses on the way back home. Make sure your windows are darkened. And then sometimes medications are helpful, and we do prescribe them from time to time to patients who need it. Another issue is that appropriate time between two shifts. You must have appropriate time, at least 11 hours between two shifts. I had multiple patients who get overtime on a shift work. They go home and 8 hours later they have to be on the next shift. That is an absolute no-no, and make sure you don't submit to that request, and talk to a doctor or somebody who can help you to not overtime when you are on shift work. Thank you very much for your attention, and we will see you next time.